What if I told you that something as simple as your morning routine, something you've probably done for decades, could quietly be putting your life at risk? A 73-year-old man was found dead in his bed. Not from a heart attack, not from a stroke, but from something far more unexpected, something most men would never suspect. A morning masturbation gone wrong. His heart gave out, during what should have been a brief private moment of release. Alone, in silence. And tragically, this isn't an isolated case. This is your warning. I'm Dr. Moit Kara, urologist, men's health specialist, and for over 30 years, I've helped thousands of men over 60 stay strong, sexually vibrant, and emotionally connected, not just in the exam room, but in every part of life. So today, I'm going to walk you through something most doctors are afraid to talk about. The 7 dangerous mistakes older men make when masturbating in the morning, and how these silent habits may be weakening your heart, damaging your prostate, and draining the joy out of your life. And mistake number 4. Almost every man makes it, every single day, and it could be slowly stealing your energy, your confidence, even your ability to feel. But before we dive in, make sure to hit that subscribe button and turn on notifications if you're serious about protecting your health and staying sharp, strong, and sexually alive well into your 60s, 70s, and beyond. And if this message resonates, type 1 in the comments. If not, type 0. I read every single response. Let's begin. Mistake number 1. Masturbating immediately after waking up. For many men, waking up with an erection feels like a green light, a signal from the body. You're alive, you're ready, go for it. And especially for men over 60. Morning erections can feel like proof that things still work. But here's the truth. No one talks about. Acting on that urge immediately before your body is fully awake can be dangerous. When you're asleep, your body enters a state of deep rest. Your heart rate slows, your blood pressure drops, and your nervous system shifts into low gear. Upon waking, your system needs time. Maybe even 30 minutes to gradually adjust and return to normal activity levels. But if you jump into sexual stimulation, especially intense or fast stimulation, before that transition is complete, you're forcing your heart and nervous system to make a sudden leap. And for older men, that leap can come with a cost. Men have reported dizziness, heart palpitations, tightness in the chest, even blacking out. In rare but very real cases, it can trigger cardiac events. Think of your body like a car that's been sitting in the cold overnight. You wouldn't slam on the gas before the engine warms up, right? The same logic applies here. But it's not just your heart at risk. Your brain chemistry is affected too. When you stimulate yourself too soon after waking, your brain gets hit with a surge of dopamine, the pleasure hormone. At first it feels good, but the crash that follows. That's what leaves many men feeling emotionally flat, sluggish, even unmotivated for the rest of the day. What should have been a moment of vitality becomes an invisible energy drain. And here's the kicker. The older you get, the less flexible your body becomes in handling those abrupt changes. What your heart, nervous system, and hormones could bounce back from at 30 might now leave you fatigued or vulnerable at 65 or 70. That's why I strongly recommend this simple change. Wait 20 to 30 minutes after waking. Hydrate. Breathe. Move. Let your blood pressure stabilize. Let your nervous system catch up. Then, if you choose to engage in pleasure, your body will be far more prepared to enjoy it safely. This might sound small, but over time, this single habit could protect your stamina, heart health, and emotional balance more than you realize. And trust me, this is just the beginning. Because the next mistake, it doesn't just drain your body, It rewires your brain. Quietly, persistently, and the effects can be devastating. Mistake number 2, using porn that overstimulates the brain. Let's talk about something that's become almost reflexive for many men. Using porn to get aroused in the morning. Especially in the age of smartphones, it's so easy. Just a few taps and you're watching high-definition, fast-cut, over-the-top stimulation, all before you've even brushed your teeth. But here's what's happening beneath the surface, especially for men over 60. Your brain is getting slammed with an unnatural flood of dopamine. That's the neurochemical tied to pleasure, motivation, and reward. And while a little dopamine is good, too much too fast is like pouring gasoline on a fire. At first it feels powerful, addictive even, but over time the brain adapts. It numbs itself. The receptors that once lit up with joy begin to dull. And the result? What once excited you no longer does. You start needing more intense content just to feel the same spark. Real-life touch feels flat. Your partner's body, once a source of deep intimacy, now feels distant, even dull. This isn't just about arousal. This is about connection, confidence, joy, presence, purpose. I've had men in their 60s and 70s sit in front of me and say, "I don't feel anything anymore, Doc." Not just sexually, but in life. And they have no idea it started with a few minutes of overstimulation in the morning. What's worse, as we age, our brain's ability to recover from this kind of overload gets slower. It takes longer to restore balance. The damage sticks. That's why I urge you, step away from the screen. Instead, use memory, imagination, touch. Bring your awareness back into your body, not out onto a screen. Reconnect with the sensual human part of the experience. This is about preserving your brain's ability to feel, to love, to live. And if you thought overstimulating your brain was dangerous, wait until you see what happens when you physically strain your body during climax. Most men have no idea how much pressure they're putting on themselves in that moment. We'll talk about that in mistake number 3 coming up next. But for now, if you're still watching, let me know this matters. Type 1 in the comments, because this conversation. It's about more than just sex. It's about reclaiming your energy, your connection, your life. And this is just the beginning. So we've talked about how jumping into stimulation the moment you wake up or relying on overstimulating content can slowly wear down both your body and brain. But now we need to talk about something even more dangerous, something physical, something men do without even realizing, and it's one of the biggest silent risks to your heart and nervous system. Mistake number 3, masturbating. While holding your breath or straining. Have you ever caught yourself tensing up during climax? Holding your breath, clenching your jaw, squeezing your thighs or abs? If so, you're not alone. This might be one of the most common habits men develop as they age, yet it's almost never discussed. And the consequences can be far more serious than you'd think. I see it all the time in my practice, older men unknowingly turning a moment of pleasure into a full-body strain. They hold their breath. They push. Their faces turn red. Their chest tightens like they're lifting a heavy weight. What they don't realize is they're triggering something called the Valsalva maneuver, a reflexive action where the body builds internal pressure by forcefully exhaling against a closed airway. It's something we naturally do when lifting something heavy or bearing down during a bowel movement. But doing this during sexual climax, especially first thing in the morning when your blood pressure is already elevated, that's a recipe for disaster. I've seen men faint. I've seen strokes, I've seen heart rhythm disturbances, all triggered by that one moment of unconscious straining. Even if it doesn't cause a medical emergency right away, the cumulative damage can still be severe. Straining like this repeatedly over time can lead to vascular damage, weakened pelvic floor muscles, compressed nerves, reduced sensitivity in the genital area. Some men come into my office complaining of a strange tingling or a persistent numbness in the groin. Others say they've lost sensation or struggle to climax. They assume it's age or worse disease, but often the root cause is far simpler habitual straining during climax. And here's the truth. Climax is supposed to be a release, not a full-body effort. Your body isn't a machine. It's a delicate, responsive system, especially as you get older. The cardiovascular system, the nervous system, the musculature, they all need gentleness and awareness to function properly. So what can you do? Breathe. Relax. Let go. If you've spent years tensing up out of habit, now is the time to unlearn that pattern. Let your shoulders drop. Let your jaw soften. And above all, let yourself breathe. You'll not only reduce the risk of serious health events, you'll also enhance your pleasure and deepen your connection to your own body. And remember, just because you're breathing correctly doesn't mean you're fully in the clear. Because there's another habit, one most men never think about, that could be quietly setting you up for repeated infections, painful inflammation, and even long-term prostate damage. Mistake number 4, not urinating before or after masturbation. It might seem minor. What difference could a quick bathroom trip really make? But as a urologist, let me tell you, it makes a massive difference. And for men over 60, skipping this step can come with serious consequences. Here's what happens when you don't urinate before masturbation, especially first thing in the morning. That concentrated overnight urine just sits in your bladder. Now add physical stimulation, muscle contraction, and increased internal pressure. For men with even a slightly enlarged prostate, this combination can lead to incomplete bladder emptying, urethral irritation, a painful backup of fluids. And that's just the beginning. Because when you also fail to urinate afterward, you're leaving behind semen residue and bacteria in the urethral tract. This creates the perfect environment for infections to grow. I've treated countless older men suffering from chronic urinary tract infections, burning or stinging sensations during urination. A strange feeling of pressure or heaviness in the lower abdomen. Many of these men never imagined that something as simple as not peeing before and after could be the cause. For those with a sensitive or enlarged prostate, the risk is even higher. That leftover irritation can trigger prostatitis, a painful recurring inflammation of the prostate that can interfere with sexual performance, urinary control, and overall quality of life. Think about that. One small habit, protecting you from a world of discomfort. So here's what I recommend. Always urinate before it clears the urethra and reduces bladder pressure. Always urinate after it flushes out any remaining irritants or bacteria. It's one of the simplest, most effective ways to protect your urinary and sexual health. But because it feels minor or unnecessary, so many men skip it. Don't be one of them. If you care about aging well and you want to avoid unnecessary doctor visits, medications, and long-term damage, make this step a non-negotiable part of your routine. Now, even if you follow all the advice I've shared so far, there's still one more mistake that could be doing physical damage from the outside in. It's not about blood pressure, not about hormones, and not about timing. It's about how you actually touch your own body. And what I'm about to reveal might surprise you because it's something most men think they're doing right. Even with the gentlest touch and the most mindful breathing, there's still one critical danger that many men overlook: repetitive physical trauma that accumulates over time. And by the time you feel something is wrong, real damage may have already taken place. Let's talk about that now. It's not always what you feel in the moment, it's what builds up over the years. For many older men, the decline in sexual sensitivity or the emergence of pain doesn't come from one single event. It comes from repetition. Year after year of harsh mechanical stimulation takes its toll. Fast, aggressive movements, tight grips, lack of lubrication. Each instance may seem harmless, but together they create a pattern of trauma. And how does the body respond to trauma? Through inflammation. Just like how a sprained ankle swells or a sore joint aches, the sexual tissues respond in kind. But unlike a twisted ankle that makes you limp, this inflammation is internal and often silent. It starts small, a little less sensitivity, a longer time to climax, a slight disconnect from pleasure. But over time, those minor changes become permanent shifts. You may not even realize what's happening. You may assume it's just part of aging, but in reality, the nerves, blood vessels, and tissue structures responsible for pleasure are being slowly worn down. The signals weaken, the sensations fade. And worst of all, once nerves are damaged, they heal slowly, if at all. The tragedy. Most men don't feel the warning signs until it's already late. That's why how you touch yourself matters. It's not just about achieving release, it's about preserving the precious connection between body and pleasure. A more relaxed technique using proper lubrication. Taking your time. These aren't just comfort strategies. They're protective ones. Think of it like this. Would you use sandpaper to polish something delicate? Of course not. Your body deserves the same care. But even if you treat your body with care, there's another trap that far too many men fall into. And this one doesn't show up in the skin or nerves, it shows up in the heart, the mind, and the emotions. Because if you're masturbating from the wrong emotional place, the damage isn't just physical, it's deeper. Mistake 6. Masturbating when you're emotionally low or anxious. This is one of the most silently destructive habits I see because it feels like relief, but often delivers the opposite. When you're feeling down, stressed, lonely, or disconnected, turning to masturbation can seem like a quick escape. And for a moment it might help. A brief rush of dopamine, a tiny flicker of control. But what happens afterward? A surprising number of men, especially over 60, report the same experience. Moments after climax, they're hit with a wave of sadness, or guilt, or emptiness. Why? Because the body got stimulation, but the soul didn't get what it was really craving: connection. At this stage of life, emotional balance is fragile. Your nervous system, your hormone levels, your sense of meaning. All of it is more closely tied together than ever before. When you use pleasure to numb rather than nurture, it disrupts that fragile balance. It teaches your brain that pleasure equals isolation. That touch equals escape. And over time, the brain starts to dull its own response. You feel less. You crave more. But the satisfaction never arrives. I've had countless men tell me they feel flat, unmotivated, even mildly depressed, and they don't know why. They say I'm doing the same things I always did, but I don't feel the same anymore. Often this cycle of emotional depletion begins quietly. You don't even notice it at first. You just think you're having a slow day. But underneath, your emotional reserves are running low. And when those reserves are gone, it's not just your mood that suffers. Your relationships, your creativity, your will to engage with life, they all dim. Pleasure is supposed to lift you up, not leave you hollow. So if you notice you're reaching for release when you're anxious, bored, or emotionally off balance, pause. Step away. Breathe. Call a friend. Take a walk. Hug someone. Remember, real self-care doesn't come from escaping your feelings. It comes from tending to them. Your emotional health is just as vital as your physical strength. But even if you're emotionally grounded and physically careful, there's one last mistake that can undo all your efforts: the mistake of ignoring what your body is trying to tell you. Mistake 7. Ignoring the signals your body is sending. This might be the most dangerous mistake of all. Why? Because it's not about doing the wrong thing, it's about ignoring the warning signs. And unfortunately, it happens every day. A little numbness here, a weaker orgasm there, a strange tingle, a subtle ache in the groin, burning during urination, pressure that wasn't there yesterday. Most men brush these signs off as just getting older, but they're not just age. They're messages. Your body speaks to you quietly at first. It tells you when nerves are inflamed, when blood flow is restricted, when the prostate is irritated, or the bladder isn't emptying properly. Masturbation can actually help reveal these issues early if you're paying attention. But that's the catch. Most men don't listen until the whisper becomes a scream, and by then it's often harder to fix. I've seen men lose sensation permanently. I've seen chronic pelvic pain, persistent urinary tract problems, even sexual dysfunction that could have been avoided if only they had paid attention early on. And what would it have taken? Just a quick visit to the doctor, a simple scan, a conversation, a test. But instead, embarrassment or pride gets in the way. The silence becomes a sentence. You owe it to yourself to listen, to really listen, not just to your thoughts, but to your body. If something feels off, don't wait. Act. You've made it this far in life by listening to your instincts. Don't stop now. Protect the years ahead. Because if you've been with me through all 7 mistakes, then you already know awareness is power. And your journey toward better health doesn't end here. In fact, it's just beginning.